Chapter 32, Women's Health Care. Health maintenance refers to the measures that can be taken for prevention or early detection of specific diseases. Many times a woman may only see a gynecologist or NP for all her medical needs, so it's important that we provide the information regarding important screenings, preventative measures, and treatment options. One of the things we need to do is to be sure we have a good medical history. Box 32.1 breaks down the various areas by categories that we need to assess. Family history is very important, especially when we are looking for risks for certain types of cancer. Remember to get a list of medications and complementary and alternative medications. A complete head-to-toe exam is needed to establish a good baseline. Looking at our family history can help guide other areas of assessment that are needed. Education on preventative care. A few of these include obesity and smoking. Having labs drawn to monitor for dyslipidemia should occur. Talking about risk for osteoporosis, osteoarthritis, stroke, and cardiovascular disease is necessary as well. The various screenings are listed on your screen. As nurses, we must educate on the importance of these, and we must understand what they are detecting as well. The self-breast exam is something we need to assess if our patients are doing them, and if not, educate on the correct technique. Your book has a great box on exactly how to do these. These should be done 1 week after the start of her period each cycle. If she no longer has periods, she should do it on a day that is easier to remember each month. Clinical breast exams should be done every 3 years for women ages 20 to 39 and every year for those over age 40. The provider will complete this by using inspection and palpation. A mammogram can be used as a screening tool or a diagnostic tool. They should be done yearly for all women over age 40. Women who have had suspicious areas or a higher risk due to family history should start younger. Vulvar self-exams should be done monthly for all women over age 18 or younger than 18 if they're sexually active. Chronic HPV is a risk factor for vulvar cancer and can spread. It involves inspection and palpation. They should report any new moles, warts, or any other type of growth changes that are noted in the skin. Also report areas of inflammation or itching. Pelvic exams should be done 2 weeks after her period, and she should refrain from intercourse, douching, or any other products for at least 48 hours prior to the exam. The provider will be assessing external organs, looking for any atrophy, cyst, tumors, or inflammation. The speculum exam will look at the cervix and the vagina. They look for size, shape, and color. If a pap smear is needed, a sample would be collected at this time. The pap smear can detect cancer cells or precancer cells. They will also complete a bimanual exam, which will assess the uterus, fallopian tubes, and ovaries. This is done by the examiner using their hand to palpate inside the vaginal cavity and pressing on the outside of the abdominal wall. Listed on the screen are various benign disorders of the breast. Fibrocystic breast changes occur mainly during the reproduction years. The cysts and thickening of the breast tissue is not cancerous. Pain and tenderness can occur with hormonal changes around the menstrual cycle. Treatment depends on the symptoms. Most time, NSAIDs can alleviate the discomfort. Reducing caffeine intake can help as well. Fibroadenomas are the most common type of benign tumors of the breast. They are common during years of the 20s. They contain both fibrous and glandular tissue and are firm, rubbery nodules that can move. They may be tender for some women. They are typically located in the upper outer quadrants of the breast. Ductal ectasia is common as a woman approaches menopause. Manifestations include dilatation of the collecting ducts, which become distended and filled with cellular debris. These changes will cause an inflammatory response that causes a mass that feels firm and irregular, enlarged axillary nodes, and nipple retraction, pain, and discharge. These are the same findings you can find with breast cancer, so accurate diagnosis through a biopsy is needed. Diagnostic eval is needed anytime something suspicious is found. This can be done via mammogram, ultrasound, MRI, or biopsy. Nursing considerations include helping the woman during an anxious period if something suspicious is found. Explanation of the procedures and what to expect is another nursing consideration. The cause of breast cancer is not known, but there are some risk factors. Some of these include white women are at higher risk, early menarche or late menopause, long-term hormonal replacement, excessive alcohol intake, overweight or obesity are a few. See box 32.2 for others. Manifestations include being able to palpate the mass, dimpling, nipple retraction, changes in the skin or shape of the breast. Therapeutic management includes picking a treatment measure, often in a combination of more than one type of treatment. Radiation, chemo, and various types of surgeries are options. If a mastectomy is a treatment of choice, breast reconstruction may be needed. This will be discussed during the treatment option consult. Some women want the reconstruction right away, while others want to wait before doing it. Psychosocial concerns regarding the change in their body image is a big concern. Other psychological changes can occur for women or their spouses include difficulties eating or sleeping, problems at work, and marital relationships can be affected. A few menstrual cycle changes can occur that we must be aware of as to how to assess and educate our patients. First is amenorrhea, which is the absence of menstruation. If normal, it happens before. First, it's amenorrhea, and it's the absence of menstruation, and it's normal if it happens before menarche, during pregnancy, during the perineum and lactation, and after menopause. Amenorrhea at other times is called either primary or secondary. Primary occurs if the girl passes the age that menstruation typically starts, which is age 9 to 15. So if she has never had a period before this age, then that is primary amenorrhea. Secondary is the cease of menstruation for 6 months or longer in the women who have established a pattern of menstruation or absence of 3 normal cycles. Some things that can cause this is pregnancy, diabetes, hypothyroidism, and hormonal imbalances. Medical treatment is geared at fixing the underlying problem. Nursing considerations include teaching proper nutrition and also providing emotional support. Abnormal uterine bleeding is when there is an abnormal frequency, lasts longer, occurs irregularly, or excessive amount. The most common cause include pregnancy complications, anatomic lesions, breakthrough bleeding from contraceptives, systemic disorders such as diabetes, uterine fibroids, hypothyroidism, or blood coagulation disorders, and failure to ovulate. A few tests are typically done for a woman experiencing this and include a sensitive pregnancy test, coagulation studies, and a test to determine if ovulation is occurring. These can help determine possibly the cause of the problem and also if she's experiencing any complications. A common treatment is the oral contraceptive pills that contain both progesterone and estrogen. They will cease ovulation. A few other options include a laparoscopy, D&C, and endometrial ablation, which will permanently remove the endometrial lining that can be done, or a hysterectomy may be needed. Nursing considerations include encourage the woman to seek medical attention as appropriate. We also discuss keeping a log of the bleeding to present to the provider. We educate on proper nutrition. Remember, if she's bleeding, you're going to see a drop in her hemoglobin, so encouraging foods high in iron can help. And of course, we'll provide support to the woman as needed. If she needs to have a hysterectomy and she wasn't sure if she was done having children, she may need additional support at this time. Pain must be distinguished between if it's cyclic and occurring at the time of each month related to a menstrual cycle, or is it an acute pain. Acute pain could mean ectopic pregnancy, maybe an appendicitis or other acute issues. Mittelschmerz means middle pain that refers to the unilateral pelvic pain that occurs midway through the menstrual cycle and at the time of ovulation. Primary dysmenorrhea is a pain that occurs with the menstrual cycle with no pathological reason. This is typically known as cramps and can vary in severity between women, but many times there's a familial tendency to the severity. For most women, the pain will start a few hours before her period begins and will last 48 to 72 hours. The pain is more spasmodic in nature. Therapeutic management include oral contraceptives, NSAIDs, and warmth. NSAIDs should be taken around the clock for the 48 to 72 hours to achieve the best pain control. The warmth can be a heating pad or a rice pack to the abdomen and to rest in a comfortable position. Endometriosis occurs when the endometrial tissue is present outside of the uterus. The cause is basically unknown. This group of tissue outside of the uterus responds to the hormones in the same way it does inside the uterus, and this causes pain and pressure on the adjacent tissues. Also, there are prostaglandins that are secreted by these endometrial lesions, and they can cause scarring and adhesions, which are very painful as well. The two main symptoms are pain and infertility. Painful intercourse can occur as well. Management can either be medical or surgical. Oral contraceptives are the drug of choice for women if it is not looking to become pregnant. Surgical treatment differs on a severity, but a laparoscopy can be performed and lysis of the adhesions is a starting point. Nursing considerations include providing her with some non-pharmacological measures, providing support, and allowing her to voice her concerns. PMS is premenstrual syndrome. It's a group of symptoms that happen during the second half of the menstrual cycle. It can vary in the symptoms and severity. A few symptoms include headache, bloating, hot flashes, appetite changes, depression or sadness, marked anxiety, reduced interest in daily activities. Others are listed in box 32.4. Cause is unknown, but theories think it's an imbalance between estrogen and progesterone. It can be very hard on a family when the woman experiences this. Therapeutic management is based on the symptoms. A few treatment options can be geared towards diet and nutrition. A diet higher in carbs may help with the mood and food cravings. Vitamin B6, 100 milligrams per day, helps for some women with improvement in the mood and energy level. Reducing caffeine can help as well. Antidepressants or oral contraceptives can help for some women. Nursing considerations include education on the disease and comfort measures for each woman, also educating on keeping a symptom diary, which can help determine certain triggers as well.